Very good morning, students. Very good morning, doctors. I think one of our student asked me, sir, you said like males have a successful suicide more than females. The incidence of males having successful suicide more than females is seen more than females, right? So, sir, can you explain us all the important points regarding suicidal tendency? See, suicide, the topic of suicide is not actually a broad one, it's a shorter thing because you may get roughly either one MCQ or may not, but still, just because you ask me just to tell about suicidal tendencies, I will tell, so no problem, just sit back, relax and just watch it, and roughly I think it will be one or two MCQs, one or two important statements, but still you listen the topic. Okay, so the most common mode of suicide is hanging. Remember this, it's always an MCQ in forensic medicine as well as psychiatry. Now what is the suicide rate? What is the suicide rate? You may not get this, but still roughly some people may give this question. 11.3 per 1 lakh population. Please remember this rate. Now how many suicides occur per year in India? How many suicides occur per year in India? That is something roughly 1,60,000. Okay, now if you come to the risk factor, males commit more suicide than females, right? And one of the most important risk factor is unemployment. Yes, it's highly seen in India as well as other countries also, but most common one of the risk factors is unemployment. And further, mental illness. If the patient is suffering from mental illness, right, something like maniac, if he's a maniac, if he's a schizophrenic patient, something like, he may have a suicidal tendency. Which mental illness? Something like mood disorders. But how much percentage patient suffering with mood disorders they commit? That's something like 15% of them have mood disorders, right? Just 1 minute. Mood disorders. Then schizophrenic, if the patient is a schizophrenic, how many of them mostly be schizophrenic? There's something like 10 to 12% of the schizophrenic patient have suicidal tendencies. I already said na. Then substance use disorder, if he has a history of substance use, then something like anorexia nervosa. Yes, people, if they are suffering with this disorder, anorexia nervosa, we already discussed, he will be having less than 18% of the BMI. We already discussed, you forgot, please revise. Anorexia nervosa, bulimia nervosa and binge eating disorder, very important MCQ, examiner's fan favorite question. Okay, next, yes, anorexia nervosa, substance use disorder. Then borderline personality disorder, very very important. I'll write the full form, some might get confused. Borderline personality disorder. Okay, disorder. Okay, now there are some more factors which may lead to suicide. So we have gender, unemployment, mental illness, and if they have access to means plus methods. For example, if they have access to sleeping pills, if they have access to toxic compounds, if they have access to poisonous compounds, obviously they will make sure that they have the tendency to commit suicide. They will easily commit suicide. If they have a history of past attempting for suicide, if they have a history of past attempt suicide, if they have hopelessness, if he is suffering from hopelessness, something like a wife which left her husband, a wife who left her husband, the husband becomes hopelessness because he has no one to look after, he has no one to care like his mother. That wife obviously will take his money, will take his property, will take his children. So in that way the man will be left hopeless. So in that case the man might commit suicide, obviously. Now if you ask me something, sir, that's okay up to it, but what about the treatment? The treatment part. Treatment is important. It's not that much. Main the risk factors. The risk factors are very, very important, but the treatment is also sometimes given as MCQ. Okay. The first and foremost thing is ECT, electroconvulsive therapy. Okay. As all in all, it starts electroconvulsive therapy. Then you can give ketamine. Ketamine, you know ketamine, the opioid. But ketamine can be given only for temporary relief. Is given only for temporary relief. It won't give permanent relief. Can you tell me what is the most common side effect of ketamine? Hallucinations. Patient will have tremendous hallucinations. You can't even imagine, so many colors in front of the eyes, and it seems like the sky is being touched by with his bare hands. Okay. Then you can give one more drug, that is lithium, right? Then you can give one more drug called clozapine. You can give clozapine, but remember one thing, lithium and clozapine, they can easily reduce suicidal tendency risk on long term use. They can easily reduce the suicidal tendency on long term use. Okay, what are those two? Lithium and clozapine. But what drug is used for temporary relief? That is ketamine. Ketamine is given. Okay. Now, one thing you remember, this is important. You might be asked, what are the drugs that are contraindicated in or that should be avoided in suicidal patients? Can you tell me? Anyone, can you tell me which drugs should be avoided, that are avoided in suicidal patients? Anyone, tell me the answer. Very easy answer. Okay, very easy. Can anyone? Okay, let me tell the answer. TCS, tricyclic antidepressants should be avoided. Please remember this point. Very important MCQ. Why? You might get a question like, a 28-year-old female has attempted for a suicide previously and he was brought by his parents to the doctor. So which of the following drugs should be avoided? You will be given lithium, you will be given something like ketamine, you will be given clozapine, and you will be given amitriptyline. Now which one you will keep? Which drug should be avoided? Can anyone tell which drug should be avoided? Anyone? Obviously amitriptyline is avoided. Lithium you can give, clozapine you can give, these two for long term prevention of suicidal risk. Ketamine is used for only temporary relief from suicidal tendency, but amitriptyline, which is a tricyclic antidepressants, is highly avoided. Okay, so remember, tricyclic antidepressants should be avoided in suicidal patients. Now, previously we discussed about tricyclic antidepressants, so we also discussed about something called TCA toxicity. Now what is the drug for TCA toxicity? I already told you what is the drug for TCA toxicity. What is the drug? Sodium bicarbonate. Please remember, my doctors, please remember, don't forget these simple things. These will be the MCQ. Why are you not revising? Most of the people are not revising. Revise. Okay, so we'll meet with the next topic. Until then, your wise doctor.